Hello and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Midwifery. And here with me, I have a special guest. It's Heather Heinrich. Welcome, Heather.
Hi, Kristen. How are you doing?
Good. It's so lovely to have you here today. Heather, you are going to speak at the Gold Midwifery online conference of 2022. And we want to talk about your very interesting and very important topic that you will be presenting on. But first, let's get to know you a little bit. Talk about your background, your work, and where in the world you are.
Sure. So I am a registered midwife in Canada. I work in the Northwest Territories, which is in the northern half of Canada, so pretty far north in the world. We're above the 60th parallel of latitude up here. So yeah, quite far. Um, across the span of my career, I've been a midwife for about 10 years now, and across the span of my career, I've had the pleasure of working in urban and remote settings, both in downtown Toronto, as well as in a few different communities in northern and remote Canada. And I had the opportunity to help bring birthing services back to a community where they hadn't had access to birthing services for over 20 years. So I've been really lucky to be able to do some of that.
Yeah.
And the reason that it's really important to me is because I'm an Indigenous midwife, and access to high quality perinatal health services, including birthing services, is something that is a challenge for many Indigenous communities.
Well, thank you for sharing that. Yes, you brought up a very important point there. It is challenging to get care, and we're talking about that you introduced services where there were none before. Talk a little bit about that. I can imagine there were lots of barriers in place. It was certainly not easy to create something like that, right?
Yeah, I mean, I was really lucky. I grew up in a urban center. I'm an
Mhm.
urban Indigenous person. I'm from Winnipeg, Manitoba, but a lot of our communities, I'm Métis, and a lot of our communities lack access to those services. So
Mhm.
I always wanted to support our communities to be able to access birthing services. Um, Especially in areas where there are no birthing services in the community. And I always knew that was going to be a big challenge, especially because I would be someone who didn't grow up in that community, and maybe didn't have as many connections. Even if I went to a more remote community where maybe I have family or friends, I still wouldn't be from there. So knowing that I was going to be sort of coming into an unfamiliar community, um, I wanted to make sure that I was going somewhere where they were looking for someone to help support the return of birthing services. So I saw that the community of Hay River, Northwest Territories, wanted to hire two midwives to bring birthing services back to the community and to establish a midwifery practice. And this is something that the government of the Northwest Territories and the territorial health system was very supportive of. So we had a lot of support from the system and from the community to reinstate these services. So some of the challenges that we experienced weren't necessarily with people not wanting it, or resistance from people within the system. There were certainly people who were worried about bringing birthing services to a remote community. So we were able to provide a lot of training and information to both practitioners and community members to be able to make sure that we were providing safe services that were supported by the bulk of people involved.
Oh, wonderful. That's beautiful to hear. It sounds like access is an important part, especially in the rural community there, but also it's a cultural aspect too. I can imagine you will talk about that in your presentation, that midwifery and Indigenous communities going back thousands of years really is very different from the midwifery that we see in other parts, let's say in North America or Canada in the urban areas there. You will talk about bias and racism there in care for Indigenous communities. So there was a lot, right? This is another added layer. Not only you're in a community that's didn't have access before, it's remote, and then you want to, of course, have the cultural aspect. You want to bring birthing back to the way that it makes sense for the community, right? Can you talk a little bit about that too?
Yeah, so in my presentation, I'm going to actually share a few stories from my experiences, just as an individual, as well as a student midwife and as a practicing midwife. Some of the experiences that I have had really highlight the importance of um, integrating culture and language and tradition
Mm,
and traditional knowledge into the services that the mainstream health system provides. We know that when people are able to access care that resonates with them, so
mm,
that should be care that is it's relevant to the context of their culture, to the context of their location, to all sorts of different things. We know that when we're able to provide care that that does that, it will better meet the needs of the community. And who better to lead and guide that care and hopefully provide a lot of that care than
mhm.
the people who live in a community themselves.
Absolutely, absolutely. It makes so much sense. I also feel that we can learn a lot from the Indigenous midwives. I'm a midwife myself. I'm very interested to find out more about their care, because they're not only caring for the birthing persons in their childbearing years, but also, it sounds to me, and correct me if I'm wrong, they're providing care for the family from beginning of birth to the end of life as well, right?
Yeah, so traditionally in many Indigenous communities, certainly not all, but in Métis communities, and as I understand a lot of other Indigenous nations, the midwives in those communities would provide care to people from the time that they're born, throughout their reproductive childbearing years, of course, and
Mhm,
then would also be supporting people and families through death. Um, we view death as, and death and birth are very interconnected. It's the beginning of life and the end of life, and you can view
mhm.
this all as a circle. And so when we look at things from that perspective, it it just makes sense that a midwife is helping people through these great transitions in life.
Absolutely beautiful. Now, looking at your presentation, and without giving too much away, because we want, of course, everybody to come to the presentation, what are you hoping our viewers will take away from it?
So I'm hoping that people will be able to hear the stories that I have to share and be able to um, see in some of those stories some ways that they can work themselves as individuals. They can support people to get better care, to provide better care, and things that the health system can do to work towards that as well. We know that underserved communities, racialized
Mhm,
communities, especially Indigenous communities, very much especially, um, suffer from disproportionately poor health outcomes
mhm,
compared to non-Indigenous communities. I know the data for Canada. I don't know it for the rest of the world off the top of my head, but I understand it. It's sort of equivalent.
mhm.
Um, and so figuring out how to provide better care for those communities, which actually means working with those communities,
Right.
is is really important. And I'm hoping that people will be able to start to understand some key principles that they can bring to the table to help make sure that that's happening.
Wonderful. Thank you so much, Heather, for talking about the wonderful work you're doing out there in the community and the presentation and spending time here with me. Thank you so much.
Thank you.
Mhm. And for our viewers now, if you would like to find out more about the presentation Exploring Bias and Racism in Sexual and Reproductive Health Care in Remote Canada, a collection of stories by Heather Heinrichs, and also the other presentations that are part of the conference, we would like to invite you to go to goldmidwifery.com to find more. Thank you so much, everyone. Bye bye.